Hello, everyone. Welcome to the first ever episode of SPEA Speaks. This episode will be focusing on some challenges we have seen in our dental schools due to some new regulations set in place due to the COVID pandemic. In the past month, SPEA sent out a poll to dental students across the nation and found a few key points we found not only relatable, but also situations where students found solutions to some of these key concerns. For this episode, we will keep the student names and the school they attended anonymous to help us focus on the importance of the issues rather than the school the problems arose at. I hope you find this information not only relatable to your dental school experience, but maybe even find some solutions to the problems you're seeing. Thanks for joining us.
One of the things that I've heard about going on is actually students that tested positive. And actually, I've had a couple professors that are involved with SPEA that came up to me this week and said, "Hey, have you heard about this rumor going on? Students testing positive, but still coming into clinic because obviously we have clinic requirements. We need to get things done, and so since that urgency or sense of urgency is there, you still come in, but obviously you're putting patients at risk. You're putting your peers at risk by doing that. And one of the things that the professors urged me to do is maybe instead of like the school having to put more punitive measures on us as students, trying to cultivate a peer-to-peer thing where we're having those discussions as peers saying, hey, if you're testing positive, you need to be staying home. If you have even symptoms of COVID, then, for the good of your patients that you're seeing and for your peers, you need to be staying home. But if that is happening, that's something that definitely I think SPEA needs to talk about.
Yeah, absolutely. Has anyone else seen anything like this at school? Because I know at our school right now, we're actually having the complete opposite problem. We have people who, when it's their turn to assist and not be the operator, it's not their week or their appointment or whatever, they're filling out, we have this like check form that you have to do before coming into the clinic, and they're filling it out with no, because they don't want to waste their time assisting. Like they are like, well, I'd rather stay home, and they're being super selfish. So we're running into that two ways. As SPEA, we haven't talked about that, but we did as ASB, and kind of some things that we said is if you ever fill that out with a no, then we brought it up to administration that you should be withheld from coming to clinic for 2 weeks, because that's the time that you're supposed to be out. So if you're going to start answering no to those questions, then you need to be out for 2 weeks. Also, we said that we should probably be getting tested for COVID at the end of every clinic week or day or whatever that looks like, but it needs to be more frequently, because people are trying to claim that, oh, I have COVID, I'm going to go get tested, and then they're missing 2 days of clinic because they wanted to go on vacation for a 5-day vacation or whatever. And so we're looking at that. Also, there's a TPX coming up. I know this isn't about clinic, but there's a TPX coming up for the sim lab, and 3 people have already told me that they're going to pull a COVID and take the TPX later because they don't feel prepared. I'm like, that's not really fair.
Oh, yeah.
I think there's also a gray area too, when at least, like you said, there's a little checklist that we have to fill out. Like, do you have any of these symptoms or whatever? But sometimes maybe you have a symptom or two, but is that due to COVID?
Absolutely.
Or
like a headache,
flu season's coming up? Yeah. Or you have a headache. Like sometimes you just get a headache, but
I'm dehydrated.
Click yes, then you're being penalized for your honesty, even if it's not something that's related to COVID. And at least for us, we only have so much clinic time. Right now we're not able to kind of switch it around. So if you're out for 3 days while you get tested or whatever, and you miss 4 clinic appointments, you're in trouble for, seeing your patients and doing what you need to do. So that I think there's a little bit of gray area and kind of question within students' minds, not just at my school, but everywhere, okay, I want to be honest, but how do I know if this is something that's actually being caused by COVID or not?
Absolutely.
Yeah. I actually ran into that situation earlier this month where I woke up on Monday morning and my roommate came up to me and he said, dude, my girlfriend woke up with 100-degree fever today. And his girlfriend had been at our house over the weekend. And I was like, well, okay, what's the protocol here? Because the protocol is for, if you have symptoms yourself. But again, like, I don't want to put patients at risk at all. Like, that's not why I went into dentistry. Was I want to help people, not hurt them. Again, you don't want to be penalized and miss that time for your honesty, but you're trying to weigh not putting patients at risk either. I ended up getting tested, and then I tested negative, and I was able to return to clinic. But I did miss a couple of days of clinic. But it goes back to, and this is where I think SPEA, and we just have to generate a culture of, honesty, because, if people are being dishonest, then we run into the problem that you brought up, where people are just trying to get out for 2 days. But like, if you truly think you have symptoms, then you need to go get tested. But if you test negative, like, should you stay out for 14 days? I mean,
No.
I don't know.
No, I agree.
Yeah,
you shouldn't be penalized for trying to be safe, but people are taking advantage of the system also.
How long are you guys, or how often are you guys getting tested? Like, how long till you guys get your results? Because, like, for us, we have to get tested every week, and a lot of the time you get the result like that day or the next day.
That's how ours is.
So we're not getting tested regularly. We have Sentinel testing where like 5% of us are randomly selected to be tested for coronavirus, but not everybody is being tested for coronavirus.
Oh, interesting.
Yeah, we have the same situation. Our campus does mitigation testing, is what they call it, and randomly select people every week. I was selected 2 weeks ago, but that was the last time I was tested.
Is your like school student body happy with that, or is there like something?
I mean, I haven't heard any grumblings about it personally, and our administration has been like really, really, really on top of us in terms of making sure that we have a mask everywhere, and they hand it out to us. In addition to the N95s that we wear in clinic, they've also supplied us with KN95s to wear that's mandatory in our lab when we're doing lab work, and even just around the school. Like, they really don't want you wearing a cloth mask around school. It's either a KN95 or an N95, and they've taken chairs out of our student lounge so we can't sit too close together, and are really, I mean, you can only regiment that so much too, because when we're in clinic and we're waiting in line to get, in sterilization or supply or whatever, it's not feasible for all of us to stand 6 feet apart, because then the line would like weave throughout the clinic and onto different floors, but they're trying to keep us apart as much as they can. It's just not always doable.
So in terms of testing, we're also not being tested regularly. Like, at most, we're trying to keep occupancy down, so just reducing the amount of people in clinic at any given time. But we're facing a lot of the same issues that you guys have brought up. Some of them have been resolved. So I mean, like the low PPE, running out of PPE, stuff like that, we kind of got through that at the beginning of August. Although unfortunately a lot of students are still resorting to bringing their own PPE in terms of like face shields and things like that, because we're just not really happy with the quality or the fit of whatever our school's supplying. New issue that we've run into recently in certain departments is that we've had low instructors, which is not something I've ever experienced before. And certain departments have had to cancel clinics and send patients home because there would just be no instructors to supervise us. So I'm not sure if that's a COVID-related issue, but that seems to be something we're dealing with right now.
Do you think it's because a lot of your faculty are in the high-risk category as far as age, and so they're staying home?
We've had some good faculty that have been pretty committed to coming in. I'm not sure if just the pandemic in general has drawn people's priorities maybe away from the faculty.
Honestly, I think a bigger issue at this school is, like, as being a D3, I'm a little worried about my education, and I understand that the D4s missed a couple months, so they want to do most of the procedures. I'm worried about like the transition when they graduate, how it's going to be for like us D3s coming up, because I feel like maybe we're not going to have the same amount of experience as the current D4s had when they transitioned over.
Yeah. And so how many months did your school miss?
We had like maybe 2 months off, and then we opened our urgent care clinic, and that was just very voluntary. Like our school didn't want anyone to come back if they didn't feel like they were ready or if they weren't comfortable with it. Timeline's a little blurry because
Yeah, absolutely. It wasn't a for sure start
voluntary for
date.
a long time. Yeah.
Yeah. Yeah, I think that that's definitely true. I know that that's been discussed kind of within our school too, is, you know, the D4s are kind of taking over. We were out of clinic, all of us, for 5 months. No one was allowed in. And so the D4s, that's really the time when they don't have anyone competing for patients or chairs over the summertime. And they were running into this problem of, look, that was when we were really supposed to get ahead of on all of our, you know, CEs and our comping and all of that. And now we're kind of 5 months behind. So we feel like we're not going to be prepared when our current D4s are gone, because they had a whole year ahead of us of screening patients, treatment planning, doing perio, doing all of that. I think that that's probably universal for most of our schools, right? Is everyone else kind of feeling like that?
We, as D3s, started in the clinic maybe a month later than we normally would. So I don't think that any of us necessarily feel like we were kind of jilted with that, but administration and faculty are encouraging us, if we have like certain cases that the D4s, you know, are still trying to meet their D3 requirements for certain things, that we just give it to them, because we didn't really have that much of a delay getting into clinic, but they definitely had a decent chunk of time taken away from them to kind of give it up to them so they can use that for their requirements and kind of get caught up. But honestly, as far as I can tell from the D4s that I've spoken to, most of them are pretty caught up with that stuff. We've been working full capacity in the clinic for a while.
Yeah.
Yeah, I mean, that doesn't mean necessarily that like every single chair is full in the clinic, but if you can book a patient and see them, you can. Like, there's no restrictions on that.
Do you have to do forehand dentistry, or you can see a patient by yourself without an assistant?
So each bay has 2 of the extra oral suction machines that we use. It's usually four-handed dentistry, and we've also allowed the D2s to come in and assist us in clinic, because technically they're just doing their didactic stuff and their preclinical stuff, and that's kind of scheduled in rotations for them. So their preclinical lab is not full all the time. So when they're not doing that stuff, they have been given the option if they want to come into clinic and assist us in clinic. So not only are the D3s and D4s assisting each other, but we've also kind of enlisted the help of some of the D2s.
There's something I wanted to mention about like requirements. I thought this was an interesting way that our school found a small solution to an issue of like not enough patients. They started assigning us like the team dentures. So 2 students are working on the same patient for a denture. And like you both do your lab work individually and go through all the steps that you would as though you were doing the denture alone. But like you share that one patient and one of those dentures ends up being delivered. So you still at least like get the process of planning a case, even if there's not enough patients.
Mm-hmm.
Are
you guys having a problem finding denture patients, removable?
No, it's not that. It's more like clinic availability.
Oh, okay, got it.
Yeah.
Kind of limit the amount of people in there, but still giving the same opportunities to everyone. That is interesting.
Yeah. And then have you guys started doing like things in the SLC to make up for lost clinic
I'm not
time?
sure what the SLC is.
Oh, sorry, the sim lab. When you work on the mannequins.
We have not. No, we have not returned back to sim lab.
Okay, so that was something else that they were doing, just like give us, I guess, more hand skills time. They're not giving you additional like things you could do in the sim lab, just I guess learn more.
No, and I think that's because the D1s and D2s need to be in there to do their thing, and they're already scheduling that in rotation, so that's not full capacity all the time. So there's really not availability for us to be in the sim lab.
That is
I have a question for everyone. So our school made a COVID task force committee in the dental school, and there's like a bunch of professors on it. But I noticed that they didn't ask any students or get any student input on it. And I'm wondering if that was kind of a theme across all the schools, and maybe I feel like if students were involved in the conversation, maybe some of these things would become aware, the administration would become aware of them, and then like they wouldn't actually be things that are occurring.
I do think that it would make more sense to have students in that to be able to discuss, like, that's not really relevant to us. We don't need that space. Using the microwave in the lounge is high priority for us. So things like that they didn't really account for, but.
Yeah, so I think it's a thing of concern because tuition seemed to stay the same, fees seemed to stay the same, but nobody was actually in clinic for a few months, up to 5 months in your case. So it seems like, yeah, tuition like might stay the same. We're all in Zoom class, but some of the supplies and materials that went unused, where did the money go? Like, why did we have to pay full fees? I don't know. I think that should be something up for discussion rather than just having everything stay the same. Yeah, what are your guys' thoughts on that?
So there's like two sides of this coin. Like dental schools, they make their income from seeing patients and providing treatment and billing them for the treatment that we do. So they did lose that income, which I completely understand. But also, like, there are certain things which I feel like they shouldn't have us be paying for, like the transportation system that's non-existent, or the gym that I have to book 2 weeks in advance to go to. If the school doesn't have money to give us tuition reductions or anything like that, they should be like, hey, come back in a year, we'll give you a bunch of free CEs, like one free CE for the next 5 years or something to like contribute to our education. Because
I love that idea.
Our tuition goes towards our dental education. And if we're getting a slightly reduced education, just make up for it in the future.
I do love the idea of the CE classes because that's kind of a win-win for everyone. We're going to need those CEs. They really don't have to pay anything for it, and it would make us feel like we actually get something out of it. That would definitely be worth it. I think that's a good thing to bring up.
So my husband, unfortunately, is always like the voice of logic anytime I want to go on a rant about, not reimbursing tuition or how ridiculous everything is. There are certain aspects that I try and keep in mind, whether it's legit or not, just for my own sanity, like tuition reimbursement for certain things. Yeah, they didn't use that stuff, but now the technology that they had to invest in for Zoom and things like that in order for us to continue our classes online, at least when the pandemic was happening, is like, a decent cost, and the licensing for that, and being able to have, a Zoom call that goes over an hour, you have to pay for that service or whatever. So there are, additional costs with face shields and the masks, at least that my school is supplying me. I'm like, okay, I try and tell myself, all right, that kind of makes up for it a little bit. There's always, the flip side of the coin that you have to consider.
We're now being joined by Dr. Mike Maru, the director of SPEA. Dr. Mike Maru, what are your thoughts on these conversations we had with the students about these clinical changes due to COVID that we're seeing?
Individuals need to talk about these items openly, and especially in a professional manner. So I think what you're doing with SPEA and with this conversation is great. Something that I wanted to add in, first off, is we're in a trying time in the history of America. And focus into our little microcosm of dental school, and of course things are ever changing. Me as a practicing orthodontist, it felt like every single day I had new regulations that the CDC or that my local county was imposing on me. I was having to try and follow up to the minute what they were changing, and I can only imagine as a dean or as a faculty member, or anybody in this situation, that it's got to be tough. So, first thing that I want to say is to the students and also to the faculty, be patient in the process. It's ever changing, and it seems that everybody's doing that. But know that the schools and the administrations, even though they may make a mistake, it's not done on purpose. And they're doing their best in these ever-changing conditions. And then I would pose that back to the schools too. Know that the students are doing their best, and there's no bad intent if something minor and negative occurs. So number two, I really like this quote by the CBJA chair this year, Dr. Mike Kurkowski. He said, and this is July time, during this crisis, when everything seems in flux, it is comforting to remember that the values we pledge to uphold remain unchanged. So I think flux is the operating word there. What we knew on March 17th and what we knew on June 1st and what we knew on September 1st and what we know today are vastly different. The guidelines are vastly different. And honestly, in another week from now, the guidelines are probably going to change again. Just know, that our responsibilities as dental students and as practicing dentists doesn't change. Our patients are number one. And number two, just in this flux period, be a little bit more patient with our faculty. I do have one suggestion, and I would recommend this both to the students to bring to the faculty and to the faculty to bring to the students. I think it is even more important than it normally is at this point in the history of the U.S., but especially in our dental schools, to have open lines of communication. Again, so much is changing, and there's a lot of unknowns, which translates to a lot of anxiety, especially on the part of those individuals who are trying to get an education, trying to graduate. So open lines of communication are imperative. So just as a recommendation, regardless of what that line of communication looks like, it needs to happen. One thing that I've seen work really well at schools in the past is creating some sort of a task force or a liaison, a student liaison from each class that can work directly with the faculty. If there's information that the students have, rather than post it all over Facebook because they're frustrated, they can go to that liaison. That liaison can take it to the faculty. It can be done professionally. The faculty then can address it and bring it to the students. I think that back and forth communication where grievances, frustrations, and issues can be aired without broadcasting it to the world. Anyways, that was a long answer to your short question.
No, I think it was awesome. I think that it's important to remember that when everyone else is struggling and we're all having these same difficulties in clinic and difficulties just in school in general with these new regulations, it is important to remember that patience is always the best route to go, and to trust in the process that everyone is doing the best thing that they can try and do. And like you said, there is no ill will. We're not trying to hurt anyone. We're not trying to make this difficult for anyone. We're just trying to be safe, make sure everyone out there is being safe. So it's a good point. Thank you.
Right on. Well, thank you for having me, and thanks for what you do.
Yeah. Thank you, Dr. Maru, and students, for joining us for this first episode of SPEA Speaks. We appreciate you listening.